everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Alfentanil. Its brand name is Alfenta. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Alfentanil is an opioid analgesic that has a rapid onset of action and is typically seen to be used during surgical procedures. Aside from its analgesic or anti-pain properties, it also has anesthetic as well as hypnotic properties. In terms of indications for use, Alfentanil can be used during a surgical procedure for an analgesic, and it can also be used for anesthesia in a surgical procedure as well. Now, before somebody was to use Alfentanil, there is a contraindication that they must clear, which in this case would just be a hypersensitivity to Alfentanil, and there's also some precautions and warnings that they should be made aware of. So in terms of precautions, Alfentanil is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. Because of the impaired psychomotor function and syncope that can sometimes happen with Alfentanil, this medication will put the elderly population at an increased risk of experiencing falls, and in this population, falls can lead to fractures. Bradycardia, or a slow heart rate, and hypotension, low blood pressure, have both been reported with the use of Alfentanil, so these two parameters would have to be monitored. If this medication is used with benzodiazepines or other CNS depressants, it may put the patient at an increased risk of experiencing hypotension or low blood pressure. Opioids may sometimes lead to adrenal insufficiency due to inadequate levels of cortisol. Anaphylactic reactions have been reported with the use of Alfentanil, so the medication would have to be administered cautiously if a patient had a hypersensitivity to other opioids. Potentially life-threatening serotonin syndrome can occur with the use of Alfentanil, but patients would be at an increased risk of experiencing serotonin syndrome if they were using this medication with other medications that affect serotonin levels, such as SSRIs, or selective serotonin reuptake inhibitors. Medication would have to be used cautiously in individuals who have a head injury because they may put themselves at an increased risk of experiencing respiratory depression. If this medication is used by a patient who has a seizure disorder, they may put themselves at an increased risk of experiencing a seizure. And once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use Alfentanil, they would typically be given this medication intravenously. So if somebody is using Alfentanil for an analgesic during a surgical procedure, and this procedure is less than 30 minutes, they would typically be given 8 to 20 micrograms per kilogram intravenously. Then they would continue to receive the medication intravenously at a rate of 0.5 to 1 microgram per kilogram per minute. If, for example, the surgery is greater than 45 minutes, they may receive 50 to 75 micrograms per kilogram intravenously. Then they would continue to receive Alfentanil at a rate of 0.5 to 3 micrograms per kilogram per minute. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Alfentanil, so I'll go over some of those here now. Up to 28% of patients may experience nausea, and up to 18% may experience vomiting. We mentioned that hypotension and bradycardia may occur, while hypertension or high blood pressure and tachycardia, a rapid heart rate, may also occur. Some patients may also experience involuntary muscle movements. Some more rare but serious side effects would be anaphylaxis, muscle rigidity, an increase in intracranial pressure, development of a seizure or serotonin syndrome, and finally respiratory depression. That's all we're going to talk about today with Alfentanil, or Alfenta. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.